In the stabilisation phase, we want to build on what we've now gained in the second stage, which was improved range of movement. So hopefully at this point, we've got the patient to be able to move the shoulder a little bit better. Now we want to try and stabilise those movements. We want to try and build on strengthening some of those smaller muscles. So the patient can continue to do that in a safe way, in a more natural way, before we start obviously overloading the shoulder and building actual strength through certain movements. I'm going to show you 6 exercises in total, 3 on the floor and 3 seated. But as always, there are hundreds of exercises that you can do. These are just some examples of the exercises that I would usually give to my patients when looking at improving stability through the shoulder. We're going to look at, first of all, again, the shoulder scapular retraction, so the scapular setting. So we've already shown you that in improving range of movement. We're now going to put it in this exercise, but building a little bit of strength through it. So I'm going to ask my patient to bring their head in a more neutral position. So just rest their forehead on the floor and try and be as relaxed as possible. Often when lying in this position, the patient's hands are actually supine, so you do need to, so they'll usually be in this position. So straight away you need to make sure that you're bringing the shoulder into external rotation, opening up the shoulder joint by bringing the hands into more of an anatomical position. From there, what we want to do is we want to squeeze the shoulder blades together. So often if we try and break the exercise down, it's a little bit easier and make sure that we get the right movement from our patient. So we're going to squeeze through here, hold that, and then lift the thumbs up towards the ceiling. So if we try and twist the hand and squeeze the thumbs together and push towards the ceiling, perfect. And then release back down to hands and then shoulder blades, good. So again, shoulder blades first and then thumbs come up and aim for the ceiling, perfect. And then hands back down and then release through the shoulders. That way it really does help to encourage this movement first, because if you go for the whole movement straight away, so if I ask my patient just to lift their hands off the floor and aim for the ceiling, sometimes they're not engaging the scapulars as much as what we want. So if we start with the scapular retraction first and then the lifting through the arms, it helps to just ensure that we get that improved range of movement, that correct movement pattern, and really trying to strengthen the areas that we're targeting. The next exercise I'd like to do is what is called a Serratus anterior push-up. So I'm going to ask my patient to come up onto all fours and then come down onto elbows. Excellent. Now, straight away we need to make sure that the weight is through the arms, okay? So we don't want weight back here on the knees because that's not, we're loading this area, so we need to make sure that the weight is pushed forward. If this is too hard for your patient to start with, simply to make it easier, just bring the knees further underneath your patient, so they just walk the knees further in, like so, okay? But if they can, the further the knees are away, the harder the exercise, because we're putting more weight through this area just here, okay? So what I'm going to do is I'm going to ask my patient just to relax through the shoulders, keeping this nice and tight, but relaxing here. And I want to see a hollow here. So the shoulder blades are lifted and the thoracic's now dropping. From there, we're simply now going to go the opposite way. So we're now going to lift through the thoracic area, arching up through here. So what we're working on is the movement of the shoulder blades. So Mac, if you can continue to do that for me. So we're working on that serratus anterior muscle that I mentioned earlier on. And back up again. That muscle that connects from the rib cage underneath the scapula and holds onto the scapula and holds it in place. And that's what helps to move the shoulder blade in and out. So as we lift up, it's pulling the shoulder blade back and down like so. And then as he relaxes back, it's sliding, obviously it's stretching and allowing that that scapula to drop back over that rib cage. So we're really working on that muscle. This is really good exercise for anyone that's working on any postural issues, winging scapulars. To be honest, a really good exercise for most people to do, especially because we're always on computers or phones. I would say majority of people have got a little bit of rounding through the shoulders. This exercise can really help to strengthen the relationship of the, where the shoulder blade sits against the rib cage and hold it in place. Perfect. The next exercise is on all fours this time. So coming up onto your knees, hands straight. Perfect. And then in this position, straight away, what we need to do is we need to make sure our patient is equally loading through each point. So there's equal amount of weight through each knee and each hand, okay? From there, we're now going to ask our patient to lift their hand off the floor. So the shoulder that they're okay with, lift that off, and they're going to move it now. As they're moving this hand, the weight is now equally distributed between both knees and the other arm. So the patient should start to now feel this shoulder is having to stabilize a lot harder than obviously what he was when he had both hands on the floor. Can you feel that? Yeah. Perfect. So it's a case of making sure that this is nice and strong, shoulder is down and in, and the more he moves this, keeping the stability, keeping this nice and strong and not allowing it to drop or move around too much, is being able to hold that position and then just pause and rest. You can do both sides, there's nothing wrong with that. So, just to make sure that the opposite side is getting just as much treatment, because this is a great exercise for anybody, regardless of if you've got a shoulder injury or not. But ultimately, obviously, we're to work the bad shoulder, to strengthen that bad shoulder, we want to lift the good arm, and it's the bad shoulder hand that's on the floor still. Next, we're going to show you the 3 exercises in the chair. Moving on from the stabilisation exercises that I showed you on the floor, I'm now going to show you 3 exercises that you can get your patient to do in a seated position using a good old resistant band. So this is a looped resistant band. You can use the ones that obviously don't continuously loop, they're just a sheet. As long as you've got that resistance throughout is the main thing. I like a resistant band for 2 reasons. One, because they're cheap and easy, and they've got no excuse. They don't have to try and, store big equipment anywhere, and they can easily get hold of one. But also because they get the resistance on the way out as well as on the way in. So you have that constant resistance. So you're working both eccentric and concentric throughout movements. So we're going to start with, I'm going to ask my patient to hold onto the band, and I'm now going to ask Mac to do an external rotation. Again, remembering that scapular retraction, we need to make sure the shoulder blades are in and the elbow is now tucked in. Patient will always try and take the elbow away from the body, but we do need to try and encourage them to keep the elbow in and keep the movement in true external rotation. So patient is holding the band with one hand, so the good arm, and now he's using the bad arm to move through that motion. Good, just drop the elbows a little bit, excellent. And remember to always keep that scapular retraction, so keeping the shoulder back and in. Perfect, so not just focusing on this movement, they're also focusing on keeping the shoulder blades back and down. Perfect, elbow in. Excellent. Good. So that's external rotation. In true nature, if we're going to do one way, we're going to do the other. So for this internal rotation, you want to either get your patient to use a partner. So obviously I'm going to be the partner today, or you could get your patient to put the other end round something like a null post or a door, for example, something that they can obviously anchor it against, and then they're going to bring the arm across the body. Excellent. And then release. So the movement is exactly the same. Perfect. Just keep the elbow back and down, remember. There we go. It's so easy to cheat even knowing you know what you're doing. So elbow back and down, there we go. And shoulder blades back and down, good. Excellent. So moving on, next exercise, what we can do is ask your patient to put the band underneath their foot. Really important is the shoulder setting. So we need to make sure that the scapulars are back and down. Okay, so putting the scapula, putting the shoulder blade into the back pocket. Holding that position, they're now going to try and lift as much as they feel comfortable and then back again. As soon as they start to lift, the shoulder will want to start to come forward. So you need to remember to remind your patient again, shoulders back and down and then lift and back down again. Good. If they can, pause here, shoulders back and down. There we go. And then back down again. Okay, perfect. Scapular retraction, then lift. Perfect. And back down. Again, with that movement is, or all these movements, really important to make sure the scapulars, the shoulders are where they should be before doing any other activity or any other movement, should we say. So I'm now going to ask my patient to turn the chair sideways on because we're going to do a scapular retraction movement. So we are going to simply take the arm from being extended out in front of us to being pulled back in. Now I'm not bending the arm at any point, the arm is straight and all that movement is coming from my shoulder blade. So if you remembered back to when we did it on the floor, we did it very much on our elbows. We're going to do exactly the same but with an arm straight. Okay, you can get your patient to do both arms because sometimes having both arms is a little easier to navigate and then try with one, but you can just go straight to the one. It's entirely up to you. Okay, so I'm going to ask again your patient to hold on to the other end. You can either be your patient's partner or you can get them to around the knoll post of the stairs, doorknob, whatever is available to obviously anchor at the other end. But it needs to be at a stretch where they can feel that pull. And then they're going to pull the shoulder blade in, perfect, back and down. So try not to activate those upper traps, perfect. And again, back and down, excellent. And again, perfect. So the whole point of this exercise is that they can feel the shoulder blade moving. Okay, it's not about what the arm can do, it's about control. So the body shouldn't be really moving too much, it's just about controlling that shoulder blade movement. Perfect. And just to show you two arms, so if you grab hold with both arms back for me, and exactly the same again, pulling, perfect, excellent, and again. Good. Making sure the shoulder blade's going down, down the back. Perfect. There we go. One more. Excellent. And that concludes the stabilisation phase. Ultimately, the common theme across all these exercises, so whether you use the same exercises I've used or if you use some different exercises, the main purpose of the stabilisation phase for the shoulder really is the ability to hold the shoulder blades back, stabilising that scapular setting position, being able to hold that and move the arm at the same time. So when we're doing these kind of things, having that ability to know where your shoulder blades are, having the resistance and being able to move. Even when you're doing internal, external rotation, shoulders should be back and down and feeling what those scapulars are doing, because that often is what people and patients will lose. They'll have the ability to have their shoulder in this anterior position and they'll be doing movements in this position, but we need them to have that open posture. So being able to scapular set and then do these movements. And once they can do that, that's then when we move on to the next stage.